Welcome to Ask the Horse Live. I'm your host, Michelle Anderson, Digital Managing Editor of thehorse.com. Tonight our topic is PPID, Early Signs, Diagnosis, and Treatment, brought to you by our sponsor, Boehringer Ingelheim Vetmedica, maker of Presend. At the end of this month, my good friend Laura is facing the tough decision we horse owners all dread. She's having her Morgan mare, Belle, euthanized before winter sets in. Laura has owned Belle for nearly 25 years. She won a world championship aboard her when they were both much younger than they are now. But for the past 5 years or so, Belle has suffered from pituitary pars intermedia dysfunction, also known as PPID, or commonly is equine Cushing's. And along with PPID, she suffered from the painful laminitis that's associated with it. Over the last few years, I've watched Laura, her veterinarian and farrier, as they work together to help keep Belle comfortable. This mare is special to me as well because she was part of the therapeutic riding herd that I managed. Laura has gone above and beyond to give her mare a happy retirement. Tonight we're going to be talking about these horses with PPID, and I imagine many of you who are listening are like my friend Laura, and you're looking for ways to help keep your horse with PPID comfortable, or you might be suspecting that your horse has Cushing's. To answer your questions about this disease, we're joined tonight by Dr. Janice Krzyzewski of Purdue and Dr. Steve Grubbs of BI. Welcome, doctors.
Thank you. Welcome as well.
Let's start with you, Dr. Krzyzewski. Can you tell us a little bit about your experience treating horses with PPID?
Sure, I'd be happy to. I've been on the faculty at Purdue University for quite a few years and see horses that have medical problems. And pituitary tumors are the most common endocrine problem of horses. So I've been treating this problem in one form or another since the mid-'80s when I came here. And as I said, it's our understanding of the disease and treatment have changed a lot, but it's still a very common problem in the horses that we see here.
And Dr. Grubbs, what has your experience been helping with the management of horses with Cushing's?
Okay, originally it began in private practice, and that was really prior to, I guess, a lot of the newer treatments that we have today. And then, it was a bit frustrating then, and not also the treatments, but just the overall knowledge base and awareness that we have of PPID. And, over the last few years, there's just been a tremendous amount of an increased knowledge base and awareness. And so with that, it's just been, it's been, fantastic to be kind of a part and to be involved in watching and just really being a part of how these, of learning more about these horses.
This event is an hour long. We're going to be answering questions that were sent in ahead of time by those of you who, when you registered, submitted questions. You can also, if you're listening live, submit questions as we go into your console on your computer. If you're looking for more information about PPID, the editors at The Horse have collected some resources that we think you'll find useful, and those are at thehorse.com/33452. Again, that's thehorse.com/33452, and you can take a look at those. There's some great things there that will give you a great overview of PPID. In the meantime, we have a ton of questions to get through, so let's go ahead and get started with the questions that were submitted ahead of time. Dr. Grubbs, I'm going to start with you. We have a question that's from Kathy in Orfino, Idaho, as well as a question, well, I'll start with Kathy. So Kathy wants to know what the early signs and average age of onset is for PPID. We also got a question from Tamara in Michigan, and she said that in her 20-year-old stock horse gelding, he has a tendency to develop a crusty neck and fat deposits on his croup, and she wants to know if that could be an early sign of PPID or maybe it's insulin resistant. So if you could address both of those questions, please, Dr. Grubbs.
Okay, and I think we'll probably separate those just a little bit, but there may be some overlap. And the first question about the early signs, and it's really a good thought there, because we do have what's kind of been classified as early signs and advanced signs. And we look at the early signs, we're really thinking, some of the things: decreased athletic performance, and maybe some bit of a change in attitude. These horses may be a little bit more lethargic. And when you think about those two things, that could be a lot of different issue, with the different other problems with the horse. But when you see those two, and then if you have, some of the others, it kind of puts PPID on the list of differentials in some of these when you're thinking about the early case. Another thing is delayed hair coat shedding. And a lot of times that's, if you have other horses, it may be the delayed hair coat shedding in relationship to your other horses. So that's one thing. And there's a term called regional hypertrichosis. And really what we're talking about there is you have a bit longer hair regionally, meaning maybe it's just in part of the neck. You'll see that they shed off everywhere else, but in that part of the neck you may have a little bit longer hair. Sometimes that's along the bottom of the neck, right around where the jugular groove is. Sometimes it's on the side of the horse, and sometimes you look at these horses, and if it's mostly on the side or around the kind of the barrel of the top of the horse, those horses may even look a little bit of different color. So it's kind of regional. It's not all over like these advanced horses that kind of look like that woolly mammoth sort of thing. So we're talking about regionally. It's some of the early things you may see. And then in the second question, you talked about fat deposits on his croup and then the cresty neck. And that's part of what's kind of called regional adiposity. That can be sometimes tendency of an early sign, but that can also be seen later on in the disease also. Laminitis is another one that could be part of an early sign. But now when we get to this this other horse, it's a 20-year-old stock horse, this gelding. When you look at this, it's a 20-year-old horse, and we've got a cresty neck and fat deposits, like I said, on his croup. And, with that neck that's a little bit bigger, and the question is, could it be PPID or insulin resistance? And if you look at that horse that's 20, I'm thinking the answer to that question, real quick, and a short answer would be yes, meaning it could be both, okay? And I say both, meaning that horse could, typically the insulin-resistant horse, if we want to term that an equine metabolic syndrome, those horses tend to maybe characteristically as a group, they're a little younger age in the horse when that starts to manifest itself. And then as these horses age, some of these horses are more prone to either become PPID, not all, but maybe some. And now that this horse is 20, one of the recommendations in these horses, if with the insulin resistance, the EMS, once they hit that 10-year of age, maybe it's something for these horses to start looking for PPID as far as diagnostically testing. But specifically with this horse, the answer could be a PPID horse, absolutely. Whether it started with insulin resistant or the EMS, I don't know, because we don't really have any more history than that. But I guess looking at this horse specifically, I would definitely think about looking at the diagnostics, speak to your veterinarian, and look for diagnostics for PPID, and also check, insulin levels, and the glucose levels. So I would probably look for both in this horse, because it's not uncommon to have both, especially when you get to that 20, 25-year-old horse. Some of these PPID horses will also have issues with insulin.
So Dr. Grubbs, I've had a couple horses that I've managed that ended up with PPID, and in retrospect, I could see the clinical signs. I didn't necessarily recognize them as they were happening. If we are aware of the clinical signs early on, can our horses, is the outcome possibly better for them, or the long-term management better for the horse if we can intervene earlier in the disease?
Yeah, I think that's another good question. And like we said earlier, there's a lot of research, and there's been a lot of research, and it's been amazing over the last 4 or 5 years. But I think that's a question that we'd like to look at some long-term studies to understand that. I think common sense tells us, and we'd like to think yes, because if we can manage these horses, because if we have insulin issues and we recognize that secondarily to PPID, and I think you're specifically speaking of PPID, but we can manage diets, and if we can get these horses on treatment earlier, the hope would be that, that we keep these horses on a lower dose for a longer period of time and keep these horses, very active, okay, and try and, keep down some of these clinical signs, or at least control them at an earlier time point. And so, we're able to manage these horses, and then hopefully we'll be able to use these horses, efficiently, for a much longer period of time.
Dr. Krzyzewski,
Yes.
we have a question from our live audience. Roy wants to know if we see psychological, mental, or behavioral changes at the onset of PPID.
Well, I think as Dr. Groves was just alluding to, and you also, most of the time the onset of PPID is very slow, and many people, once the horse is your classic, really fuzzy, poor top line type animal, you think back and go, oh yeah, there's a couple of years there he shed out later, or a lot of times what people attribute as old age changes and the horse slowing down because of old age, it's actually more that they're starting the first signs of the disease. One of the hormones that becomes abnormal with this disease is the type of hormone that can cause the natural opiates, so horses can act kind of sedated sometimes or be very calm. And I wouldn't say that's an early change necessarily, but sometimes they do seem just slower. And again, many times people attribute that to aging changes and not to the disease, but then once they start treating it, they get their old horse back, and so they realize that it was actually not just being old, but because they had the PPID.
So we had. Oh, I'm sorry. Go ahead.
I would say like bad behavior per se is really not a big feature.
Okay. So we had a couple more kind of behavior-related questions about PPID, and Carol in Indiana wanted to know if fatigue from light exercise is a symptom, and if yes, if there's anything she can do to help her horse. And then Susan in Montana wanted to know if a change where the horse starts becoming aggressive when she's never been aggressive before could be a sign of PPID or result from the PPID.
Again, being aggressive really isn't a really well-recognized feature of the syndrome. I'd say any time a horse has any kind of sudden change in their personality, probably should have your veterinarian take a look at it and make sure that that change isn't because of pain somewhere, because that can kind of make horses that were, pleasant, kind of sour if they're in pain. Certainly with the exercise intolerance, again, horses with PPID lose some muscle mass, and so that may be part of the syndrome, but I'd want to make sure there wasn't another problem perhaps that's there as well, because there certainly are horses that don't seem to, that's again it's not that it's unheard of, but it's not a real common way that people first notice their horse has it.
So, Dr. Krzyzewski, we have a question from Peggy in Illinois, and she wants to know if Cushing's follows a certain genetic line. She said that she had a mare with Cushing's, and now the son has it also. She also wants to know if it's more prevalent in certain breeds.
Yeah, that's a really great question. This is kind of what we know. There do seem to be lines of horses that have more Cushing's than others, and certainly I know of people that have mares and their sons or daughters all seem to get PPID and get it at maybe an earlier age than many other horses typically do. So there does seem to be a genetic component of some sort, just what we call anecdotally. Like, people say, oh yeah, like I can think of one horse. there haven't been enough of them to do any kind of real research study to say it any more clearly than that. When you look at the horses with this, ponies are overrepresented, Morgans are overrepresented, and Arabians are often overrepresented. And again, there's some evidence that the ponies get the signs at an earlier age than large horses. But by and large, the horses that just tend to live to be very old are the ones where you see this disease in. We don't see a lot of it in draft horses, but we don't see many 28-year-old draft horses either. So, that who knows, like if it's because there's a true breed disposition, or just that some breeds, not enough of them live long enough for it to become common. And again, I'm not sure we really know that.
That's a really interesting point. Several of the horses, or a couple of the horses that I know that have had it, were Arabians, and so I've kind of always associated it with Arabs, but when I think about it, they were extremely old Arabians and maybe older than other horses that I was managing at the time. So that's really interesting.
So yeah, that we don't know yet which one of those is, the bigger factor.
Dr. Grubbs, we have a question from you from Carol in Pasadena, Maryland, and she has a paint horse mare that's 17 and is a profuse sweater. She requires clipping because she sweats so much, and her coat is slightly heavier than average. Should Carol be worried about PPID?
Okay, that's really a good observation that that she's made. And when you look at the sweating and you look at I want to assume something here, but not necessarily, that her coat is slightly heavier than average. So I want to take that as average to maybe herd mates or horses right around her area. And so when you look at those two things, I'm thinking that we've got some delayed shedding there because we've got a longer hair coat, and then this horse, due to the increased sweating, and we've got, whether you call that abnormal sweating or whichever, we actually are kind of right in the middle of it, but we've had a study going on for possibly over 2 years, enrolling horses, looking at just what are the clinical signs that we're at initial diagnosis of these horses, and she picked out the top 2 clinical signs that were the most, as far as predictors, to be PPID positive. And the top 2 predictors in that was, first was abnormal sweating, and the second was delayed shedding. And that was 500 and some horses that that we looked at with all the clinical signs, and those were actually the top 2. So I guess to answer her question, could she have PPID? And I think the answer would be, that's probably a horse that you would want to get your veterinarian out to go ahead and to go ahead and test and take a look at, and see where you are from there. But I think it's definitely the clinical signs that that we saw that were the highest predictors. So I would definitely have your veterinarian come out.
Dr. Krzyzewski, we have a question from our live audience. It's from Karen, and she wants to know if there is such a high incidence of PPID in older horses and it's difficult to diagnose early, then is there a downside to proactively treating older horses with Pergolide, and would doing so help prevent or slow the disease progression and allow them a longer and higher quality of life?
First of all, there is a higher incidence, but it's not like all of them. So there really, as far as anybody knows, isn't a downside to doing that except to your pocketbook. But there are some thoughts that keeping the pituitary hormones in check, if you will, with the Pergolide may prevent the pituitary from getting larger. So there are some, thoughts that might be more helpful. Again, no one knows for sure yet, but it shouldn't hurt the horse. Again, the horse just may not need it, but it's a very safe product.
So let's talk a little bit about diagnosing the disease, because I went through the process with a couple horses probably 5, 6 years ago, and I don't know if there have been changes since then on how they're tested, but I remember it being very confusing and complicated. So, Dr. Oh, you laugh. Yeah. So maybe I'm not the only one who thinks that. So let's go over to Dr. Grubbs, because we do have a live question from Jennifer in our audience who wants to know, how do you test for PPID, and do you have to test to start treatment, and can you explain what the treatment would be? So Dr. Grubbs.
Okay, you may have to remind me, there's 3 parts to that.
Okay.
Give me the first one again.
Okay, so how do you...
We'll go to treatment. Okay,
how do you test for it?
Yeah, okay. And there's actually a couple of different ways, but there's probably some preferred ways and easier. Testing is as simple as if you're out, if a veterinarian comes out and they're looking at the horse, there's not really anything that needs to be done except pulling a blood sample. And they're going to pull a blood sample, send it off to the laboratory of their choice, and they're measuring just resting ACTH. Okay, and the good thing about resting ACTH is you can use it all year long, as long as you use a laboratory that has values during the fall period. And with fall period, if you may hear that a little bit during this conversation, we're typically talking about August, September, and October. And with that test, you can use it all year long. As the normal values change a little bit, they increase a little bit during those fall values. So it's a very simple test, and something easily that can be done.
So my memory of it being more difficult, has it changed during that time frame?
Okay, and as far as that, yes, because to be honest, I said back, when I was in practice looking at these horses, we used another diagnostic test. It's still used, today. It's called the dexamethasone suppression test. There's a list of tests that can be done, but those are probably the 2 most common. And the dexamethasone suppression test, is a very good, is still, fairly equal to the ACTH. But the difficulty in that one is that you have to give the horse, say, a shot of something the night before, and then you show up the next morning and pull some blood. Okay, and then you send that blood off, and then you look at the results there. So there could be 2 trips involved, and that's a test that we typically don't use in August, September, and October. So there might be a little bit of limitations there. There is some advantages, maybe disadvantages, with the dexamethasone suppression, but with the resting ACTH, it's easy. It's fairly inexpensive, and you can use it year long.
And if I can just add, if
Yep.
A horse has the more advanced disease and has the long shaggy hair coat, that right there pretty much tells you that it has it. There's still a reason to do the blood test so that you can monitor treatment and see how your horse is responding and whether you have the right dose of drug and that sort of thing. But to just say whether or not the horse has it, that long shaggy hair coat is as sensitive as a blood test.
Okay. So the next part of Jennifer's question, Dr. Grubbs, was when do you start treatment, and can you start treatment without doing the testing?
Okay.
And what is the treatment?
Okay. And I want to back up one part to that first question about diagnosing. It is easier to diagnose, but one thing that we've tried to discuss more and more and more is, yes, we're measuring ACTH, but we want to look at the rest of the horse. And then also, we said earlier in the in this broadcast that some of these horses have insulin issues too in the PPID. So probably at a bare minimum, it's always good if we can to be as complete as possible, and it's not that much more expensive to look at the insulin levels in this horse and the glucose. So we've kind of covered a lot of bases. So if we need to manage the diet or change something, we can kind of do that effectively with all that information. Now back to the treatment. And when do you start? When can you start treatment? I mean, once with diagnosis, we typically use history, and the clinical signs we see, and then if indeed, just like Dr. K had mentioned, if it's a long shaggy hair coat, we may not need to do the diagnosis and then we can possibly start that horse on treatment, and then look at clinical response from that point on. And if we do have a horse that's been diagnosed with one of the testing procedures such as ACTH, we get those results back, yes, you can go ahead and start that horse on treatment. And then if you want to, either way, whether you do the blood test or not, you want to look at the horse and see how it's responding to the dosage that you're actually administering that horse. And regardless of the blood work, we want to look at the horse. Don't forget the horse. Don't just look at the blood work. And so, because sometimes blood work may not change much, but the horse will dramatically improve. So you'll see a lot of improvement that way. So then that kind of gets another conversation that I won't get into at the end of this question. But so yes, you can go ahead and start if you've got the clinical signs, and then start monitoring, what level of, drug do they need more? Are they doing very well on the dosage that they've been started with? Based on their clinical response, as the veterinarian comes back, and as the owner themselves start looking at this horse, because, you should start seeing some noticeable differences in these horses following treatment.
So, Dr. Grubbs, we have a question from the live audience from Sandra. She said that she has, she wants to know, and actually maybe Dr. Kravinsky wants to jump in on this, but other than Presend, are there any specific supplements or other treatments that can help these horses, and are there any feeds that should not be given to a horse with Cushing's?
Well, I can jump in, I guess. First of all, the short, easy answer is no. The only drug labeled for treatment is Presend. However, these guys, they tend to be old. They tend to be, I guess, a little bit fragile, if you will. Their immune systems maybe aren't as what they should be. And so they need just general, overall, really good husbandry and care. They need, good quality diet and a lot of attention paid to just their overall well-being. It is important to know if they also have the insulin problems or insulin resistance, because that is the thing that predisposes the horses to laminitis, and laminitis is really the worst side effect, if you will, or consequence of having the disease. If they do have insulin problems, then it's important to feed a lower carbohydrate diet so that you try and keep their blood insulin as low as possible, so it's in the normal ranges. In terms of like an herbal supplement, there are some that people talk about. There has been none, unfortunately, that have been looked at that actually help very much. And there's not a ton of studies, but the ones that have been done haven't really been very encouraging about having something that takes the place of an actual drug.
Dr. Grubbs, we have a question from the live audience, and this is from Terry, and she has a horse that was diagnosed with PPID in late July and has been started on treatment. She wants to know if this time, well, she said she understands that this time of year levels are elevated, but she wants to know if her horse should be retested now. Is there any reason to do that?
Okay, and that kind of started treatment in July. We're into September. We're right in the middle of the fall period, and I guess back to kind of the one of the basic rules of thumb when we start these. If we want to, first thing I would ask, is how's the horse doing clinically? I mean, does the horse look better? Does it act like it feels better? Does some of the clinical signs, seem to be improving? Because one of the first things you'll see is these horses just feel better. They seem to act better. They move about a little bit better. If it was, some of the issues with decreased shedding, sometimes that may take a little bit longer. It depends on the severity of that, but that can take a little bit longer. But that's the first question I would ask. And then, with the testing, you could, because typically what we'll say, and I'm going to come back and contradict myself right here because we are in the fall time period, But typically, if somebody wants to retest the horse, you can do it as quick as, typically the rule of thumb is 30 days from the first day they started, the dosage of that they were dosed with the drug. So 30 days from there, you can go ahead and test and kind of see where you are diagnostically wise. But there again, how's the horse doing? If it's this time of the year, you can, but you would definitely need to look at the fall values. But if you had a July value, and that's in kind of the other 9 months of the year, you might be comparing apples to oranges, because that horse may have elevated at this point just because it's in the fall time period. And so, to make a comparison back to the July value, you might be looking at, the late November, December time period to make that comparison. You could do it now, but I wouldn't compare backwards to that value, because that horse may not have been in the fall time period with that increased value. It might even go up a little bit right now. I don't know what the value was, and so I wouldn't get that alarmed as long as it's, somewhere, getting closer to around what we consider normal for this time of the year. So I guess basic recommendation, if you do, don't make a comparison back to the July value. Hope that makes sense.
Dr. Now I'm tongue-tied. Dr. K, thank you. We're getting several questions in now about metabolic syndrome and its relationship to PPID. But can we talk a little bit about the relationship to laminitis?
Sure.
Why these horses become laminitis and how that is so closely associated with PPID?
So horses, nobody knows why, but there are some horses that get PPID that never have insulin problems and never develop laminitis. And there are others that the very first symptom they show, the very first time the owner knows there's any problem at all, is when the horse has an acute flare-up of laminitis with no predisposing cause. And then when they go and try and figure out why that horse did that, they find out that they have had an endocrine problem. The laminitis is really tied to the insulin. So if you had a horse with PPID that you could test and the insulin was normal, chances are that horse, as long as the insulin stayed normal, would not be at risk of foundering. Why laminitis is associated with high insulin is still an open question. So unfortunately, I can't tell you why that is, but the more people look at the relationship, the more insulin levels are really seem to be tied into the development of laminitis in horses. So because a big percent of horses with PPID also have insulin problems, that's why we recommend they be tested, because a lot of horses, the very first time an owner knows there's anything going on is when he all of a sudden is affected with acute laminitis. So that's a reason to take it, the disease very seriously. But that the relationship with PPID and laminitis is kind of really more of an insulin problem, and the PPID plus insulin makes that horse at risk, whereas PPID without high insulin, probably not nearly as much.
So we have a follow-up question from the live audience. Angela wants to know if a horse can have Cushing's and not develop laminitis.
Yes, many do. There are many horses that have Cushing's and never develop the laminitis.
Is that because of management and drug intervention, or is it just
that would be nice, because then we could prevent it, but unfortunately a lot of them are insulin resistant, and we absolutely don't know yet why some go on and do that and some don't. And so it's an area of like ongoing investigation. We've been studying laminitis ever since I've been a veterinarian, and we still don't know most of the answers. So it's just a hard nut to crack. But why some PPID horses have it and some don't, I don't think anybody knows that. But certainly there are enough horses with PPID have it that if you knew your horse had that, you'd definitely want to make sure he didn't have the insulin resistance too, because that's a horse that's at very high risk for getting laminitis.
Dr. Grubbs, we've talked about both Presend and use the word Pergolide. Can you explain a little bit about the relationship between that trade name and the, so that people who aren't familiar with them can understand that?
I mean, how we, okay, sure. As far as Presend, Presend is actually, it's basically the the trade name of the drug, of the product itself, and the product is for the treatment or the control of clinical signs associated with PPID in horses, and then the active drug in the in that product is Pergolide, and then they'll also see something called Pergolide mesylate, and that's just nothing more than that's kind of a salt or something else. That's a chemist's way of saying it, but the active drug is actually Pergolide, and that's what results once you if you treat a horse with the trade name drug Presend, it's got the active product Pergolide, which actually is the drug that has the effect to to control the clinical signs of PPID.
And Presend is the FDA approved drug.
That's correct.
For treating horses.
Yep.
Okay.
Yep.
So we have a question from Gail in the live audience, and she wants to know about possible side effects of Presend. Can it cause weight loss in a horse? And actually, Sandra also has a question about side effects. She wants to know if it can cause horses to stop sweating. So are there any listed side effects of the drug that people should be looking for as they're treating?
Okay. And I think if you first I'll just talk about the product, and of course Presend itself has went through the safety and efficacy studies and all those things to get an FDA approval. So those things are very controlled, and everything's watched and looked at and recorded and tabulated at the end and reported. And if you look at a label, or if you have Presend yourself, you can open up the box and pull out the actual label. It has a lot of the studies in there summarized, and that's all approved by the FDA, all the wording and everything is taken out of there. So it has a lot of these things listed. But when you look at the, if somebody said, what's one side effect, and I think it's with, when we talk about Presend, we talk about Pergolide, probably if somebody's going to call you and ask you, a question, what's it, something going to be, sometimes these horses initially will go off, their appetite will decrease once they take the product. And when you do that, the recommendation is typically you can decrease the dosage a little bit and see if they'll work through it. A lot of times we'll just take them off of it, and then start them back on the product once they go back on feed, and they do. And they, most of these horses do really, really well, after that. Sometimes people will put them on a lower dose and then increase it to get them used to the product. So, that's probably one that, that we hear about. If you want to look at the, the label itself, side effects, other things there's, when we think about that, I think of precautions. And if you look at anything, we'll say treatment Presend may cause, like we say, loss of appetite a little bit. In most cases, these are pretty mild, but you may see some weight loss. And then even on the label, I think it says something like you may see a lack of energy or sometimes behavioral changes. And most of the time, we think of those behavioral changes as, I think Dr. K said that these horses sometimes, before treatment, if they have PPID, they may act a little bit not druggy, but they have that increased opioid kind of response, and they're just a little bit, I wouldn't say sedate, but then they feel better. And I think sometimes we think behavioral change, these horses will feel better, and they do. And sometimes when we officially launched this product a few years ago, I always told people these horses will, tend to feel better typically. And if they were the grandkids horse, and they, you could put 4 kids on it and walk it around and not even pay attention, these horses get feeling better, you might start paying attention, because they might feel a bit better, you might not want to have 4 grandkids on it. You put 1. So, when we look at that. But yes, weight loss has been one that, we've actually seen. And in some of these horses, it kind of depends if they're an EMS horse and they're overweight. You kind of look at, maybe what that would be. And one thing, that I kind of will point out that, as far as, at this point, we really hadn't evaluated this product and, in breeding these pregnant or, mares that are lactating. So we don't really know. There's some evidence back that there may be some, evidence that, it may interfere the way this drug works with lactation. So, if you have a mare like that, speak to your veterinarian. I think that's, that's something there. Trying to think of any other things, but that's, that's typically, I think I tried to address the question she had, but probably if somebody, calls in and, has a question, it's when if they start out on this product, probably the biggest call we'll get. We don't, not all horses, but, sometimes that'll happen that they'll, their feed increase will decrease just a little bit, or their feed intake will decrease. But it comes back.
Dr. K, we have a question about using compounded pergolide. What are some of the concerns of using a compounded drug that isn't FDA approved for treatment of PPID horses?
Well, I guess the main concerns is that the compounding pharmacies aren't held to the same standards as, to be an FDA approved place, and so it's really kind of buyer beware. There are some compounding pharmacies that take pride in doing things well, and they probably do them almost as well as non-compounded things. I'm sure they don't do it 100%, but at least they try. There's others that are basically out to make a quick buck, and when you go and look at the product they have on their label, they have different amounts or not even any that's active. And there's, so that is all on the owner to try and sort that all out, what you can believe and what you can't. And so it's not, so that's kind of where you are with them. There is really, the place I think there's a role for compounded pharmacies or compounded products are products that are not available, that are not on the market labels for animals for whatever reason, and some of that's economic and some of it, there might be other reasons, and then you're stuck, you have no choice. But certainly if there's a FDA-approved drug, we say to use that and not to use a compounded product. So that's my, I guess, 2 cents.
We have a question for Dr. Grubbs from the live audience. Sharon says that she has a horse that has a long hair coat, but they've done 2 blood tests that have come back negative for PPID. She wants to know if she should keep testing or if she should just start treating him without a positive test.
Okay. I would probably have a couple of questions for her, and I hate to do this, but I think I will, because then she can pass these on, to her, to her veterinarian, because that's probably one. But let's go ahead and discuss it, and then she can, like I said, pass this on to her veterinarian. Those couple of questions, to kind of look at. One, they've obviously, tested the horse, so we're not talking about a 2-year-old horse with, for some reason, long hair. So it probably, everything fits the bill. And so, as Dr. K had said earlier, sometimes, if your veterinarian is, is pretty sure looking at that, you're not going to create any issues by treating this horse. And so that is definitely an option. Now, the one thing I'll let you know, once you do that, then if you want to test the horse, later on, you might not have a lot to compare it to. You may just have to see if the product is working. You're going to look strictly at the clinical signs, which we need to do that anyway. I would ask, probably another question is, what time of year did you actually test that horse, and did you use a resting ACTH? And if you did, if you just pulled one blood sample and didn't give the horse anything and sent it off, if you did that, say, in the springtime, sometimes the sensitivity of that test, it's not perfect, not 100% saying, every time a horse has PPID that it will identify it. Probably we're going to hit somewhere between 70 and 80% of those cases, during the 9 months of the year when we're not in the fall time period. We're right in the middle of the fall time period now. I don't know when you tested at that time, but if you didn't test it during this period, I would test that horse now if you wanted a positive diagnosis and you wanted to use the diagnostics, in September, because a lot of those horses are normal. The other times of the year, those PPID horses actually really increase during this time period. So, that's something I would, think about. There's other ways to, to look at this horse if you really feel like you want a diagnostic test. I don't know if we'll discuss this later, if I discuss it now, but I think to answer your question, you sure could, and go ahead and treat the horse. Just look at clinical response. If it's long hair, it may take longer than a month, like we said. It could take, sometimes 2 to 6 months to get this horse, but you should start seeing some improvement. But if you wanted a diagnostic test and you test it the other months of the year, I'd do it right now, or at least think about it. Speak to your veterinarian about doing it.
Dr. K, our next question is for you, and it's related. It's from Sandra, and she wants to know if there are ever any false positives from the blood test.
There can be. So the ACTH, which is the hormone that the horse makes that we test for PPID, is a stress hormone. It's what tells the body to make more cortisol. And so if you test a horse when it is, the best example is if you test the ACTH of a horse that is just broken with very painful laminitis, sometimes the ACTH will be really high because that horse is so stressed and in so much pain. And if you had a horse that had some other severe disease, the ACTH may be high because it's reacting to that. So if you tested a horse that was not in pain and was healthy, there'd be very, very few false positives. But sometimes when the first time you even think about doing this is when that horse has its first flare-up or first infection, something along those lines. If they're tested right at that time point, they may test very high. And if you let that, the horse become a little more comfortable, a little more stable, sometimes the values go back to normal.
Dr. Grubbs, our next question is for you. Earlier we were talking about breeds in relation to PPID, but Ricky in Virginia wants to know if it's more prevalent in geldings than in mares or stallions.
Okay, and let me back up just a second to answer that question. I spoke of a study we have going on now, and the first 500 and some horses we had in there, we didn't really see a difference in that. Okay, but that's only 500 horses. We're trying to add more and more and more, so we're hoping we'll have at least 3 times that many or more to kind of look at. So we didn't see it there. If you look in the literature, and there's a lot of anecdotal evidence of people that's practiced and that sort of thing, but it kind of bounces back and forth. But if you look in the literature, I only know of about reports where they felt like, at least in that study of horses, that geldings may be. But I think when you really look at that, and I'm not sure that that's really known, I guess the bottom line, I only know of one study where they felt, at least in those group of horses, that it might be more prevalent in geldings. But then you have to look at the population of horses, where there are more geldings tested, compared to mares or that sort of thing. So I'm not aware of anything to where anybody said it's more prevalent in geldings or mares or stallions, to be honest. Dr. K, have you
No,
seen anything?
I've never seen anything that really looked at big numbers and found much of a difference.
Yeah.
Our next question is for Dr. K. It's from Lori in our live audience, and Alex, our editor who's helping with everyone's questions as they're coming in, has said that she's received several questions on this topic. So, Dr. K, does a natural avenue such as chasteberry or chaste berry work for a horse with Cushing? So I know we addressed supplements a little bit earlier, but specifically the chaste
well,
berry.
the chasteberry has only, as far as I know, been really looked at critically one time. That was a lot of years ago. At that time, it did not seem to help at all. It didn't change the horse's values. So, to my knowledge, there's still not a study that shows that chasteberry does any of the effects that one would like it to. So that, again, horses that, if you pay careful attention to their diet overall, they'll probably do better than if you throw them a little hay and grain every day and walk away. But when people specifically look at these other supplements, nutraceuticals, things of that nature, so far nothing has really helped with their the secretion of the hormones from the pituitary, up to this point.
So for those who are looking for ways to manage the horses, maybe in addition to medication, what management recommendations do you make for them? Do these horses need more exercise? Are there specific diet recommendations that you make? Should they work with a nutritionist?
Well, that, again, the first thing I would do is see where their insulin is. Often these guys have, one of the side effects of the PPID is the muscling isn't as good. They get, so you'd certainly want to feed a palatable diet, one that the horse wants to eat, that is balanced for protein and the right amino acids. And again, if there's any question about insulin or if the horse is over-conditioned, have put some attention into getting some weight loss and having a low-carbohydrate diet. If the horse doesn't have insulin problems, then again, just a diet that keeps the horse in a good condition. And that is really as individual as there are horses. Some horses, even with PPID, can be easy keepers, but many older horses, PPID or not, start to kind of lose condition, and so, usually the senior type diets is where people go.
So for an athletic horse, does a diagnosis indicate the end of their career?
No, I wouldn't say that. Certainly we see show horses in that, and I mean, one of the things I know, I tell people that if what you're feeding a horse, or how you're managing a horse is working well for you and the horse is in good condition and has energy and all that, there really isn't a magic age when you should flip them over to senior feeds. Like, if what you're doing is working, then there's no reason not to keep with it. There are horses that compete at older ages with the disease, and they do very well. So it is very individual.
Our next question is for you, Dr. K, and it's from Val in Georgetown, Kentucky. And Val has a horse that was just diagnosed with PPID. She said that the temps in the area have been over 90 degrees and that his respiration rate has been over 100. She said, is this usual with PPID?
Well, if they have a long hair coat and are sweating a lot, that long hair coat prevents them from really cooling themselves off the way they should through sweating. And so I guess I would, if that's the case, I would certainly recommend that the horse be clipped and see if that doesn't make it a lot more comfortable. If the horse is not sweating at all, then I'd be very worried about a condition called anhydrosis, which is basically horses don't sweat the way they're supposed to, so they have to almost pant to cool themselves off. And that sometimes can be something that is seen along with PPID. So I guess I would say, really high respiratory rate is not, again, a super common sign of PPID. So, if a body clip doesn't pretty much take care of it, I would certainly have her, have her vet out to take a look and see if there's not some other pulmonary problem or anhidrosis or something like that going on.
Our next question is from our live audience for Dr. Grubbs. Ruth wants to know if there's any way to reverse advanced PPID.
Okay. Trying to understand exactly reverse. I think what we look at trying to do with these horses, whether early or whether advanced, and I think that when we get into the advanced, we want to look at the quality of life of these horses, and I think that's where we're going, with those. Are we going to cure it? No. Okay, we're not. Are we wanting to control those clinical signs, decrease those clinical signs, and look at the increasing that horse's quality of life? And I think the answer to that is yes, and that's what we're looking, to do with treatment and then management. And it's like I said, with with the diagnosis and then treating these horses, and then following those pretty closely, because a lot of times you can follow them closely up front and start to get the correct dosage in this horse, and then over time for those. So reverse it, I'm not sure. If you're thinking of curing it, probably no, but controlling it and improving those signs, yeah, that's the goal, and that's what we would expect to do.
Okay. Dr. K, our next question is for you. Shar in Wisconsin wants to know if you should vaccinate a Cushing's horse that's 30 years old. What recommendations do you have for vaccinating these guys?
So my recommendations for vaccination are, I would recommend that the horse get at least what the American Association of Equine Practitioners has said is their core vaccines, which are the vaccines that every horse should get. And that those are diseases such as tetanus that any horse anywhere can get, and the viruses that they get from mosquitoes, that sort of thing. After that, it really depends on the horse's use. And that's really a decision you make about any horse, not just PPID horses, in that, horses that are shown a lot, that are out and about a lot, you think more of the viral diseases, the respiratory diseases, and horses that are going to be in your paddock and not see a lot of, new horses probably don't really require those. But horses with PPID, they don't have the immune system maybe of a normal horse, but they do mount antibody responses to vaccines, and definitely would recommend that they continue to get the core vaccines that are recommended.
And
yeah,
Dr. Grubb, go ahead.
One of the things is just to kind of add to Dr. K, and absolutely. And there was one thing that I think we'll all kind of want to look for in the kind of the near future. One of the researchers, and I'll just go ahead and say her name so you can kind of look when this starts to come out. Her name is Dr. Amanda Adams at University of Kentucky, has actually looked at just this about vaccinating these horses with PPID, whether they be, she kind of divided them out to whether they were maybe early kind of, or I would say early disease versus, the advanced disease, and she did some things to kind of quantify that, and kind of that was just exactly what Dr. K had said. She, what she stated, or Dr. Adams stated in that was, some of these horses with advanced disease that, her recommendation is, just exactly that, is look at these mosquito-borne diseases that are out there, the core vaccines, that sort of thing, because there did seem to, they do respond, but maybe to age-matched controls, maybe not as well. So you definitely want to, to vaccinate these horses.
And I think we have time for one more question, and it's along the lines of the vaccination question. But Dr. K, I'm going to give this one to you. Leslie in New York wants to know if horses with Cushing's can still receive things like Adequan, Bute, or joint injections. Are there any concerns with the other treatments for maybe arthritis?
No, not at all. Again, horses with PPID tend to be older. They tend to be have the problems that other horses have, and so usually if they require that kind of treatment to stay comfortable, then there's no reason not to do it. Some horses even need to get corticosteroids, despite the fact that their own pituitary is maybe making too many too. So yeah, there's really no reason not to go ahead and treat them for other diseases they might have.
So we're just about out of time, but I want to ask each of you before we go if you have any kind of final thoughts on the conversation tonight and what you would like our audience to take away from our discussion. And let's go ahead and start with you, Dr. Grubbs.
Oh, okay. I think probably to reiterate some of the things that some of the important points Dr. K brought out, and but we talk about diagnostics. I think one is awareness, and it seems like with these questions there's a lot of awareness and there's a lot of of interest. And one thing about the diagnosis and understanding that and the clinical signs early versus advanced, and it looks like a lot of owners are actually looking for this at an earlier time instead of this woolly mammoth. So when we do diagnose, when we do testing, look at the whole horse in some way, and treat that whole horse, not just throwing Percend or Pergolide at these horses, but look at everything with them, but also look at insulin and glucose. So if you need to manage that diet, go ahead and do that. Don't just take care of one part of the problem if they have insulin issues, because like Dr. K had stated, a lot of these PPID horses, may have some insulin issues. So we kind of want to manage, the whole horse and not just one part of it. So I really appreciate being on here and really enjoyed this.
And Dr. K, your final thoughts?
I guess my final thought, again, thank you for having me, is one of the things that we kind of touched on, but I want to maybe go back and reemphasize, is that the hormones that horses have in the autumn is different. It's higher than they have other times of the year. And so when you're thinking about PPID in your horse, you have to bear in mind what time of the year it is, in which it's probably the only disease out there that's like that. So it's very important to think that you and your veterinarian discuss what time of year to test and the pluses and minuses of doing it in the fall versus doing it other times of the year.
Okay, so definitely on our minds right now.
Yeah.
As we're on the first or second day of fall. I want to thank both of you for joining us, doctors. It was a really great conversation. I hope that everyone listening has taken away some information that's going to help their horses. I also want to thank our sponsor, Boehringer Ingelheim Vetmedica, for bringing this event to everyone for free tonight. If you're listening and you have additional questions, I want to refer you back again to that resource article that we have online. It's at thehorse.com/33452, those 10 top resources that our editors have selected that might be able to help your horse. So we hope you can join us again next month for Ask the Horse Live. And for everyone who joined us, thank you again. And until we see you again, we're wishing you a good night and happy riding.